In this video, we're talking about the anatomy of the heart. The heart is approximately fist-sized, located in the center of your chest behind your sternum, and a little bit to the left, unless you have a condition called situs inversus, in which the heart would be located a little bit to the right, but majority of the population, a little to the left. As you can see here, there's the sternum, and then this is the mass of the heart in this x-ray. The heart is an absolutely essential organ for life. Of course, it is the organ that circulates blood throughout the body. It provides the motive force that sends blood out through your arteries. The pocket that the heart sits in is called the mediastinum. And that's basically, it's just the medial portion of your thoracic cavity with the lungs on either side. So you've got your left lung and then your right lung, and your left lung has a little bit of a notch out of it so that to make room for the heart. This is a cartoon version of what the heart actually looks like, sitting in the mediastinum with the left lung on one side and the right lung on the other, pulled a little bit back. And if you were to take a cross-section and look up at the heart and lung arrangement, this is what you'd see. Heart there, extending a little bit further to the left into the left lung, the right lung over here. The heart is surrounded by a connective tissue sac called the pericardium. Para, like perimeter, cardium, anytime you see cardi or cardio or cardia, it's referring to the heart. So it's basically, it's the sac around the heart. It's a two-walled sac. It's analogous to if you pushed your fist into a balloon, into a half-inflated balloon. You'd have one layer of the balloon covering your fist and a second layer of the balloon as an outside layer with air in between. Well, the pericardium works kind of the same way. If you imagine your fist as your heart, then you have the visceral layer of the pericardium wraps tightly around the heart and folds over into the parietal layer of the pericardium. And in between, of course, you don't have air in the pericardium, you have serous fluid, a lubricating fluid between the two layers of the pericardium. And the parietal layer of the pericardium has a tough, fibrous outer layer, and that fibrous outer layer provides a bit of protection to the heart. The serous fluid between the parietal and visceral layer basically reduces friction as the heart beats. If you rub your hands together, you can feel that they start to warm up. That would be bad if that started to happen to your heart as your heart were beating. So the serous fluid reduces that friction. The pericardium also helps contain the heart. It keeps it from overfilling with blood. The heart has some stretch to it, so it would, it can only contain a certain amount of blood. When we start talking about the factors that determine the amount of blood ejected, and the strength of contraction, we'll talk a little bit about why it's important that the heart doesn't take back too much blood before it contracts again. The pericardium can become problematic. There's a condition called cardiac tamponade. Cardiac tamponade is when you get too much fluid accumulating in the pericardial cavity and it actually compresses the heart. And since it's squeezing in on the heart, the ventricles can't fill the way they're supposed to. You see this happening if you have a myocardial infarction, a heart attack, or if you have pericarditis, which is an inflammation of the pericardium, kidney failure, hypothyroidism. There are a few different things that can cause cardiac tamponade. It can also be a complication of heart surgery. So it's something that heart surgeons and cardiologists need to be aware of. The visceral layer of the pericardium is actually a part of the heart wall itself. It's the outermost layer, simple squamous epithelium, and it's referred to as the epicardium. So just like the epidermis is the outermost layer of your skin, the epicardium is the outermost layer of the heart. You also have a layer of squamous epithelium lining the inside of the heart called the endocardium. Endo means in, so this is the internal layer of the heart wall. Looking on the diagram over here, you have the endocardium there and the epicardium there. The endocardium is continuous with the simple squamous epithelium that lines your blood vessels. In the blood vessels, it's called endothelium. When you get into the heart, it's called endocardium. And this endocardium is also what covers the valves of the heart, the little flaps that prevent backflow of blood in the wrong direction. The third layer of the heart is really the business layer of the heart, and this is the myocardium. Anytime you see the prefix myo, you should be thinking muscle, so it shouldn't be a surprise that the myocardium is the muscular layer of the heart. It's the layer that actually does the contracting. But the myocardium isn't just muscle cells, it's held together by a fibrous skeleton, and I'm using skeleton in quotation marks because it's not bone, it's collagen fibers that give the myocardium shape. Let me show you an image of that. What you're looking at here is a decellularized rat heart. So it's getting progressively more decellularized here. At this point, in this image, it's basically just that collagenous framework of the myocardium. So researchers have figured out a way to take the myocardial cells away, leaving just this connective tissue framework behind. The hope is that this technique could be used to create a heart transplant that wouldn't be rejected by the recipient's immune system. You could take a cadaver heart, strip out the myocytes in a process like this, and replace them with stem cells from the heart patient's bone marrow. So it's immunologically identical to the recipients of the transplant. Here's another view of the heart wall. You're basically looking at a cross-section. You have the pericardium here. Here's the parietal layer of the pericardium, along with connective tissue. Here's the visceral layer of the pericardium, also known as the epicardium. Little bit of areolar connective tissue underlying it. Here's the myocardium. You can see the cardiac myocytes with their intercalated discs and their branching myocytes. And another layer of areolar tissue and the endocardium. You can see what the simple squamous layer of the endocardium looks like here. So that sort of tiling, almost vaguely hexagonal appearance. The arrangement of the myocytes, the muscle fibers in the myocardium, is interesting. They actually kind of wrap around. You have 4 chambers of the heart. You have one atrium up here, another atrium there, and then you have your ventricles down here. So you have bands of fibers that wrap around the atria, and then bands of muscle fibers that twist around the ventricles of the heart. So when the heart actually contracts, the contraction starts down here at the apex of the heart. I should say when the ventricles contract. Contraction starts down at the apex of the heart, the pointy portion at the bottom. And when it contracts, the heart twists up from the apex, so it's a little bit like wringing a sponge, if you've ever held a sponge in your hands and wrung it to squeeze water out. That's what your heart is doing to blood when your ventricles contract. But I'm getting a little ahead of myself because I haven't introduced the chambers of the heart yet, so let's go do that. The human heart has 4 internal chambers. I specify human because some animals don't have 4 chambers, like fish tend to have 2-chambered hearts, frogs have 3 chambers, but mammals, like humans, have 4-chambered hearts. These chambers are the 2 atria. Atria is the plural form. You have the left atrium. Atrium is the singular form, and the right atrium. And then you have the 2 ventricles, the left ventricle and the right ventricle. Have you ever walked into a hotel atrium? Like, usually it's the first space you walk into. It's central, it's nice, it's open, it's pretty. It's the chamber that welcomes you into the hotel. So think of the atria of the heart as the chambers that welcome blood into the heart. They're the receiving chambers. The ventricles are the pumps. The ventricles are the discharging chambers. When the ventricles squeeze, that's when blood leaves the heart and goes out to the rest of the body. This is what the chambers of the heart actually look like. Well, it is an idealized version, but it's a little bit more realistic than the last slide. You have the right atrium here. You have the left atrium here, the left ventricle here, and the right ventricle there. There's a ridge of myocardium here that separates the left and right ventricle. This ridge is called the interventricular septum. The atria are smaller chambers, and their volume is somewhat extended by little ear-like flaps called auricles that aren't labeled on here, but they sit basically like that. There are also little ridges of muscle in the atria called pectinate muscles, or cone-like muscles. These are on the interior surface of the atria. The ventricles are a little bit bigger in volume, and their interior walls are lined with papillary muscles and trabeculae carni. Trabeculae carni are ridges of cardiac muscle along the wall of the ventricle. It's thought to reduce suction between the walls of the ventricle so that they don't slam together and have difficulty opening back up. The papillary muscles are these little kind of nipple-shaped muscles that hold on to the chordae tendineae. Take a look for a moment at the differences in the myocardium. The myocardium is thinner in the atria than it is in the ventricles. The atria contract, but just enough to squeeze the last few drops of blood down into the ventricles. The ventricles need to squeeze with enough force to get blood out to the organs, especially the left ventricle. Notice how the left ventricle is much more muscular even than the right ventricle. The right ventricle squeezes deoxygenated blood out to the lungs, but the left ventricle sends blood out to the aorta, where it goes everywhere else. Your arms, legs, digestive tract, skin, muscles, bones, brain, even to the heart itself. So the left ventricle needs to really pump that blood with force, and it has the thickest myocardium, so it can. Between the atria and the ventricles, you have valves. Right AV valve, left AV valve. You also have valves where the ventricles eject into the arteries, here into the pulmonary trunk, and there, even though it's not in white, into the aorta. That's the valve between the left ventricle and the aorta. Let's get a better look at these guys. What you're looking at here is a view of the heart that has been cut along this plane so that you can see all of the valves. The atrioventricular valves, that's what AV stands for, is atrioventricular. These are between the atria and the ventricles. So we've got the right AV valve and the left AV valve. These guys prevent backflow into the atria when the ventricles contract. So the ventricles can squeeze and blood only goes out into the arteries. It doesn't go back up into the atria. The right AV valve is also called the tricuspid valve because it has 3 leaves that make up the valve. The left AV valve is also called the bicuspid valve because it only has 2 flaps to the valve. It's also sometimes called the mitral valve, after a bishop's mitre. Someone thought the bicuspid valve looked like this two-flapped hat that bishops wear. The semilunar valves prevent backflow of blood from the great arteries, the aorta and the pulmonary trunk, into the ventricles. So these guys open. Here's the pulmonary semilunar valve, in there. And here's the aortic semilunar valve. These open when the ventricles contract and close, fall back closed when the ventricles relax, so that blood keeps moving forward out the aorta and the pulmonary trunk instead of falling back into the ventricles. When you listen to someone's heart, you're actually hearing their heart valves closing. That lubbed up sound is first the AV valves closing, a little bit softer, and then the semilunar valves, is that sharp little snap. When you hear abnormal heart sounds, a heart murmur, that means that a valve is malfunctioning. Either it's not closing tightly, so blood is backflowing, or it's not opening fully, and blood can't get through that pathway smoothly. The chordae tendineae are collagen cords, bundles of collagen fibers that connect the AV valves to the papillary muscles of the ventricles. So here's the flap of the AV valve covered in endocardium. Here are the chordae tendineae, the collagen cords, and here's the papillary muscle in the ventricle. So when the papillary muscles contract, they pull on the chordae tendineae and hold the AV valve flaps closed so that they don't pop open when the ventricles squeeze. And the papillary muscles that are actually extensions of the ventricular myocardium. You can see that here. Here's little papillary muscle. It's completely continuous with the myocardium of the ventricular wall. So as soon as the ventricle starts to contract, the papillary muscles contract and pull those AV valves shut. And now you know that you do have very literal, physical heartstrings that can be tugged. Although hopefully not literally tugged. We'll get more into the great vessels that surround the heart when we talk about circulation into, through, and out of the heart. That's the aorta, the pulmonary trunk, the pulmonary veins, and the vena cava. For now, though, you should be able to answer these questions. Talk about the function of the heart, the structure and functions of the pericardium, the structures and layers of the heart wall, the structures and chambers, compare and contrasting the structures and chambers of the heart. Also talking about the functions of the heart valves and the chordae tendineae.